I'd like to call the meeting to order. The Board of LOUGHRY County Commissioners would like to invite everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. All right. I'd like to start with a moment of silence. I'd like to ask everybody to still remember a county employee that was injured in that accident a few weeks ago. Roll call, start with Commissioner Stiebens.
Here.
Doug Smith is present. Jeff CULBERTSON.
Here.
VICKY KAAZ by phone.
Here.
And Chad SCHIMKE by phone.
Here.
All right. And did you two get a copy of the latest recommendations by the AG on the announce or saying your name when we speak over the phone when we talk about any county business?
Commissioners KAAZ and Commissioner SCHIMKE, this is David Van PARYS. The Attorney General has rendered an assistance to us during the conduct of our meetings. If you could, at the initiation of any statements, state your name. That is to allow the public to more fully understand who is giving the comment.
No problem. Will do. Commissioner SCHIMKE.
Roger.
Vicky. Will do.
Okay, thank you. And we'll move on to administrative business. Any administrative business this time?
I do have a couple of items this morning. First of all, I believe you all received a letter in regards to the Staggers Rail Act. I didn't know if there was an interest in putting that on the agenda for consideration next week or not.
I did talk to the fellow. I called the gentleman from Texas.
They're speaking here.
I called the gentleman from Texas that is promoting this, and he did indicate that, and it's correct, I know this, in 1980 when they passed the Staggers Rail Act, many of our railroads across the country were in a position of collapsing. They were over-regulated, and they passed the Staggers Rail Act, and that allowed for the deregulation, and they spun off a lot of the little branch lines were spun off into short line railroads and little independent railroads, and the main line, the bigger railroads prospered after that was adopted, and they're going to be reauthorizing that piece of legislation, and they're asking for local governments to the commissioners basically put our stamp of approval and say, you know, this deregulation has resulted in a lot more business coming to the railroads and benefited the country as a whole. So if you want to put it on the agenda, I can get a lot more information for you.
Okay, yeah, because I actually remember that.
It's been a long time ago.
Yeah, it was, we were in some pretty tough times back in them days. Anyways, you got any comments on that? Any other commissioners have any comments or thoughts on that? Okay.
I'll put it on next week's agenda then, if that works.
Okay. All right.
The other thing that's on here, the Board of County Commissioners last week asked me to do an analysis of the Treasurer's General Fund and Motor Vehicle Fund to see what we thought might be the true impact of the current reduction in services. I think I provided that to all of you, and I believe that most of the revenue will come back eventually once people get caught up on their tax payments, as long as we don't have a lot of delinquent taxes that don't get paid. That should be made up. The only thing that I do think is probably going to be impacted permanently, and that's the facility fees. And as you saw in there, I believe that's going to be a reduction of about $70,000. And I might be a little over estimating that, but I do think that's a safe bet that that's about $70,000. I think as we get towards the end of the year, like I mentioned last week, we would reevaluate that, and it may require a budget adjustment to accommodate that. Other than that, I think the change that the treasurer requested, which is allowing to account for the wages out of the motor vehicle fund into the general fund for the time being, would help cover us during this time frame.
Okay. And I agree. I'm not sure that the fees from the annex are going to come back. I don't think you'll see people packed in there like you used to.
Probably not.
Yeah. I just think people are going to change the ways they do business, and they probably should.
Yeah. That doesn't take a motion. It's just the board had asked me for an analysis. I think that's just a quick synopsis of my analysis.
Okay.
Janice, what was in 2017, the legal publication that you normally allow $5,000 for, but it was $18,000?
I just looked at this morning, and I would have to
was
research
something.
that, but I can't remember
Was that when
why
we
the
went to the-
publications were so out of line with the normal amount.
Was that when we went to the new tag system? Remember when the state
When
switched
the
over?
state changed computers? Or
That was 17,
software
wasn't
program?
it? 3 years ago?
No, that was in 2012.
Oh,
I'd have to look and see why the statements,
something big
not the
happened.
statements. Yeah, there was a big issue with that, and to tell you the truth, off the top of my head from that year, I can't remember. I can look into that and get back with you.
Right, the
Because that's
software-
13
Mm-hmm.
of the 16.
It just took to 2017 to get the bugs worked out.
Yeah. I don't think they're worked out yet.
Okay. Okay.
Then the other item I had on administrative business, I have the county health officer here to just give a quick update and to, I think maybe a couple of commissioners had some questions, and I thought I would bring the county health officer in for that. And maybe with the new governor's order, he might be able to, I don't want to say enlighten us, because I think everything that she has put out has been a little confusing, but to maybe answer some questions on that.
Before we jump into that, I think, I don't know if it should come up now or not, but we had visited about next week trying to get Steve Jack from the economic,
LCDC.
Yeah, LCDC, and Brandon from the
Joanne's
Chamber
from-
of Commerce
Yep.
online, and also Congressman Watkins requested to give some input from what the federal government's doing to be able to help us with the economic impact of this and how we can help benefit some of our businesses.
Yeah, I'd like to hear from LCDC and Chamber of Commerce what they're specifically doing to help our local businesses stay in business. You know, I think they should be switching gears now instead of trying to promote new business to come to town. Right now, during this, they should be figuring out ways to keep our small businesses open.
Absolutely.
So,
I can reach out to them and see if next week's meeting would work for them to be on the phone as a call-in. And I'll need to get Congressman Watkins' information from you, Commissioner Stieben, if I could, because I do not have a direct number for him.
Yeah, we'll get that.
We can do that. I'll put that on. You want that just under administrative business, so that's at the beginning of the meeting?
That'd be fine.
Okay. I'll do that.
This is Commissioner KAAZ. Could my fellow commissioners please speak up just a little bit? Thank you.
Can you hear us?
Okay.
Maybe not.
We will try to keep them on their toes with that, Commissioner.
Thank you.
Okay. All right. Mr. Miller, how are you
I was
doing?
asked to come in and kind of give an update of some of the things that have been happening, obviously in relation to COVID-19. The first, I'll just go over some of our numbers here in the local. We've been putting out on a daily basis on social media, our websites and such for everyone to follow. There has been some confusion that has been relayed back and forth, so I just want to use this opportunity to put out we are reporting across the top the confirmed cases, the negative cases, and the pending cases that are being tested. The self-reporting numbers that are in the center in that middle line are those that are calling into the health department, into the hotline, and reporting symptoms and such to our nurses who are being triaged through a laundry list of criteria. From those 299 self-reporting cases, 103 of those have the criteria that meets a high probability, which is why we're reporting those numbers, because with the limited testing through KDHE and our health department right at the moment, we're not able to test everyone that calls in with signs and symptoms, but we want to be able to put that out to the community and where those numbers are so the community is aware that we have probable cases in certain areas within Leavenworth County. Of the 51 cases, 7 of those are hospitalized. 43 are active cases because we were able to report 7 of our cases, of those 51 reported cases, have recovered. Recovered means that they've met all criteria to be back into the mainstream. We did report last week, we did have 1 death, and again, that is the number as of this morning as well. So that is our numbers. One of the things I wanted to talk about is LCF. That's kind of a hot spot or a cluster, if you will. Cluster meaning a viral cluster. And there are 9 staff.
Jamie, because not everybody at home knows what LCF stands for.
Lansing Correctional Facility, I'm sorry. Kansas State Penitentiary there in Lansing. There are 9 staff and 8 inmates that have tested positive for the coronavirus. KDHE has assigned an actual staff member out of the infectious disease. The director is on site at LCF handling and working with Department of Corrections through that process. So again, my health department doesn't have to be tied up, if you will, inside the walls dealing with that. We are on the health department side working through any contact cases, so staff members and family and doing those contact traces to our community still is coming through ours. We do have 2 KDHE epidemiologists coming out today to help within our office get caught up on some of the paperwork and contact tracings and phone calls and such. So we are working some pretty long hours, long days out the health department still on contact tracings and where some of this is coming from and quarantines and isolation orders and things of that nature in regards to those that are testing positive, need to be tested, need to be monitored, so on and so forth. So that's any question on numbers right off the bat?
Well, how are they handling the isolation in the prison? Are they isolating the prisoners, or are they transporting them somewhere else, or what's the protocol?
From my understanding, right at the moment, they are inside the walls doing a quarantine and isolation inside of the prison itself. They have brought back, from what I have been told, there is no outside work release. That's all inmates are being quarantined. The entire prison is quarantined at the moment, and working towards that, as well as working with enough staff to continue operations at the prison and such. So again, KDHE is handling all inside, so I'm not privy to everything that's happening in there. That's happening very quickly as well. What they are relaying out to me is their numbers and such, so we can monitor how that may impact our community.
Okay, and who's the actual party that's handling it within the prison?
Phil Griffith from KDHE. The KDHE, Dr. Lee Norman put out a very good video, if you will, on the website for KDHE talking about the importance of social distancing and why we're doing the things that we're doing and what that is gaining for us. I recommend everyone go and kind of watch this. Only about 1.5 minutes, 2 minutes long, but it talks about the slowing the movement down of the populations and what that actually looks like. And he referred back to, if we can slow the movement of 25 to 30% of the population from moving and doing unessential things, you gain 3 days. If you gain 35 to 40, you gain the 6 days, and at that 55% level or greater, you're gaining 10 days. That's that helping of the flattening of the curve. Unfortunately, if you use the data in the unicast and some of the things that have been talked about with the cell phone movements and such, Leavenworth County has not fared very well. We have not slowed down a lot of unessential movements, even with the orders that have come out. We're from day to day, we're an F to a D to a D minus in that kind of range compared to others that are in other parts of the state who have done better, if you will, than we have. So again, it's just showing the importance of that social distancing in that kind of piece that we really need to slow down the transmission, if you will, of the virus from person to person. We are still on track with projections of mid to late April peaking. That is what that looks like and what the numbers look like. Obviously, we're all following this very closely, and things have changed even within the last week. But our numbers, if you've just looked over the last week, a week ago we were in about 10, and now we're at 51. We gained about 8 cases, confirmed cases, just overnight. So again, we're going to see that number grow and escalate over the next several weeks. Hopefully a majority of these will be mild to moderate, can stay at home, care for themselves, and be on their recovered status. We're hoping that we don't look to have a whole lot of hospitalizations, but again, we don't know because the virus doesn't pick and choose who has comorbidities and who doesn't. We have received deliveries for PPE from the state. The first order came in last week, and that was already distributed out to EMS received some. It was a very small order, some law enforcement, fire departments we've worked through on them because they have SCDAs, and so we've kind of established a policy that the entire county is using, so we're not burning through PPE as much. The second order was a larger order that came in on Monday. Logistics is working through it now. This will also be some of the PPE that has to go back to replenish some of the hospitals. So St. John's and Cushing that are burning through a lot more PPE. We will be able to supply some of the N95. This is the PPE that comes out of the Strategic National Stockpile. The problem with this is there's nothing more that we can see coming from the Strategic National Stockpile in the next several weeks. So now is when we're going to be in that crunch where we're going into this peak time. We only have what we have on stock, and that's why it's so important right now to try to decrease the amount that's going to go into the hospitals, because these hospitals are not going to have enough PPE to be dealing in burning through 300 N95 a day. We're not going to have that kind of, and on that, it goes into some testing. Testing is important. I know we're hearing test. Unfortunately, there are no test kits for us really in the state of Kansas. We are down to very few, and very few meaning 10 or less, even at the health department, which are really being held for more healthcare providers, first responders, and such to make sure they're on the front lines. The CEO out of North Point Development in Kansas City donated $1.2 million to buy 2 test kits that are two lab kit that can run the tests that are put at KU Medical Center. They've kind of, KU has bought onto this. They've built a section off of their lab and they put them in. What they have also bought was 50,000 test kits that are coming hopefully here in the next 48 hours. This individual is working with all the health departments in the Mid-America Regional Council to get us on board to do additional testing, to push these tests through KU. The initial tests are bought. However, the expectation is that the local entities that are participating in this are going to have to pay for, obviously, the testing to actually occur at KU. There is a cost to run the test, so we don't have that number yet. This is developing day by day on phone calls, working through all the logistics. So once I have that number and know what this may cost to run some of these tests through and how we can do some, whether that's a reimbursement from a patient can pay, and so on and so forth, we may go that route. But it's a possibility. It's a very high probability and possibility that we have the ability to start some more testing here, even locally, which I think will help us identify where these cases are and where we can isolate more cases so we don't have additional community spread or clusters start with this. So again, I know it's kind of vague and I don't have all the answers for this, but this has really started this in the last about 72 hours of talks of who was going to be part of this project and who was not. And we have been invited into this project because we're part of the Mid-America Regional Council. And I can tell you that I am proud to be in Kansas right now because all 3 health departments have already been doing testing in the state of Kansas, as opposed to health departments on the Missouri side who have not been doing testing within their own health departments and communities. So this may give us the opportunity as the health department side to run more tests. Potentially 50 to 100 a day could be ran through our health department down through this process. Again, as long as supplies continue. And the biggest supply right now is the swab and the media, which is what you have to actually stick it down into, crack the swab off, and send it down to the lab. And you have to have both of those to be able to do it. And that's where the national shortage is. That's what the state of Kansas will run tests. No one has swabs. No one has media to be able to do that. Like I said, we're down to about 10 or less even at the health department. And again, a lot of that is being very critically put out of who needs to get those tests, and it's the hospital workers and first responders that are out there trying to take care of these individuals right at the moment. It doesn't mean that if someone isn't hospitalized that they won't receive the test. The test will happen in the hospital and so on and so forth. It doesn't mean that you can't go to a doctor's office and have a private order wrote in through Quest and private labs. What I'm referring to is the state lab and the health department right now running these tests.
Jamie, this is Commissioner SCHIMKE, and I don't mean to interrupt, but it's hard to also see remotely. So first and foremost, again, can't thank you and the task force, your staff enough for the great job you guys are doing. A couple of questions I did have just for my education, if you will. We talk about the self-reported a lot, and I would imagine that our statistics align pretty well with those we're seeing around the metro area, meaning, the hit rate as far as people being tested is, 10% or less. So while they have very similar symptoms, the tests are coming back negative. So my question is, of those that are doing all the self-reporting, and I know that your team is trying to triage those and answer all the right questions,
Right.
Is it probably still safe to say that there's when I say a low percentage, it's still a percentage, and every number matters, but it's probably in that 8 to 10% range as well, or is that not a safe assumption?
That could be the safe assumption, but being able to say we would interview someone, test someone, and say, I don't know if that's going to come back, and that would be the person that would come back on, and then you would do the same with someone else with the same signs and symptoms of someone else, saying, oh my gosh, they look sick, it meets all these criteria, and you test them, and that comes back on a negative. So again, yes, that's probably a safe assumption if you're just doing general numbers, but that's why we're reporting that out overall. And are we missing some that even through that criteria of those 300 that are self-reporting, are there some that aren't being put over into that probable case that could also have? So again, it is numbers, and that's why testing is so important, to be able to give that confirmation of yes it is or no it isn't. And that's why I'm still going after how do we test more people and how do we get those answers.
Well, my concern, the reason I bring it up is that, we've talked about this trend and obviously why we've gone to such substantial measures, both in the county and across the state. It could always be better, not trying to minimize that. Seems like, again, that trend and trying to get ahead of the curve, we're overrunning a lot of the hospitals and healthcare providers with people that are not positive. And so, again, reminding people that unless it's absolutely critical in regards to your health or ability to breathe or anything else, lots of people have conditions for lots of things, in which case staying home, isolating, self-care has generally been successful. And I think just reiterating that, because, again, if 9 out of 10 people that are going into one of our hospitals, one of our healthcare providers, don't have it, that's as much of the problem as the people that do. Again, that's my assumption. That's why I'm asking you as the subject matter expert if you would agree on that. And then just as a follow-up to that, Are we seeing any reports, or are we getting any feedback from these hospitals or healthcare providers, both in the county and adjacent? As we know, we have limited resources as Leavenworth County anyway.
Yes.
So thinking about Wyandotte County, Johnson County, do we have any idea in regards to, hospital, occupancy or ventilator accessibility, any of those types of things?
Hospital census, yes. That is being, again, the EICS through Mid-America Regional Council and the Healthcare Coalition within Kansas City is tracking the health. Those are conference calls on weekly basis, almost every other day, actually, that we're all communicating on a regular basis as to what the census is for hospitals, what PPE needs are for hospitals. So the entire Kansas City Metro is sharing needs, essentials, what those plans are for certain hospitals on who has COVID-19, wings and floors and levels and things of that nature is all being, in lack of better terms, being handled in the backside of just on a day-to-day basis. I mean, that is really what is happening on a day-to-day basis, even in the Kansas City Metro. And again, that's a screen, if you will, on my computer, on one of my screens. That dashboard is put up on a regular basis that we can monitor. And if anything changes, we report our daily numbers in there so the entire Kansas City Metro knows what any health department or any location within Kansas City Metro is dealing with. It's also where the expanded testing, that kind of network is coming out of, so we're all working together towards exactly what you're saying. So no one hospital is being overloaded. Ambulances aren't going to just one hospital and dropping off all of these patients. We're stopping at locals. I can tell you on multiple times a day, I'm talking to our local hospitals and the ER directors and the hospital directors and such multiple times a day.
Well, that's great. Maybe part of it is I'm either not looking in the right places or I've missed some of that information, because I think to your point, if you have somebody that falls into that critical care vertical or segment, you want to make sure you get them to the right place. And while there's, I don't know how many hospitals have these resources within 20, 30 miles, but it's probably substantial, and some coordination as far as making sure people get where the resources are versus a Shawnee Mission getting overrun, or a St. Luke's getting overrun, or an Olathe Healthcare. So I haven't seen those, and maybe I've missed it, and or if I've missed it, I'm guessing a lot of the general public has as well. So I don't know if there's anything.
I think that the core message there is, if you think you're going to need to seek care, it's that call first. And that is the core message that we've been trying to put out, is make those notifications before you just try to head somewhere or think you're going to the right location. And if you can call ahead, that's where those hospitals can say, we can't handle you, you may need to go here, or they can also talk to you on the phone and triage you to say, no, you know what, you're going to be better off staying at home, or they're going to give you that guidance before you just show up somewhere that is the wrong place to show up. And as well, you can contact the health department. You will talk to a nurse who will triage that. And we've helped actual individuals get all the way in and made those phone calls into a hospital, say, this is where you're going. We will call ahead. These are the steps and processes that need to happen. If it is a 911 situation, again, it's just making sure that you tell dispatch all of the information that these are signs and symptoms. The ambulance staff and first responder staff will be ready to handle that. And again, they are tied into the Kansas City Metro through all of these sources and systems, and we will get you to the right facility that can accept you at that time and call ahead to make sure that there's no contamination that happens at that hospital.
No, that all makes perfect sense. And again, being a little bit of a numbers guy, I just wanted to talk through that with you a little bit, because when we talk about confirmed cases, and this isn't just Leavenworth County, it starts to get across the metro and across the state. As we start to estimate what these cases will be as we get further into the month, then how many, so right now if I'm suggesting that based on all the numbers I've seen, it's an 8 or a 10% positive as far as the testing goes of those that either self-report or go into a hospital or healthcare provider. how many of those cases fall into the critical, right? Because again, if you're elderly or compromised, there's a number of things that continue to come up. I don't know if that's 1%, 0.5%, but at some point we should start to be able to forecast the type of resources that we'll need and whether or not we have them well before we need them. Does that make sense?
Sure. And again, if you look at our numbers of the 51, we have 7 that are meeting that criteria, if you will, because they are the ones that are hospitalized. And that right there is somewhat showing, even within Leavenworth County, the amount of individuals that we're monitoring on a day-to-day basis, and those that have to be hospitalized because their symptoms have exacerbated to a point that they need further care besides that home care. They're in the more severe side of things. So again, if you look at that, that's about a 2% ish close that are requiring those hospitalizations as of right now. Now, as we continue over this next week, which is what we're seeing, if we continue to keep seeing, will that seven number change? That's the unknowns.
Sure.
But we are monitoring that very closely, and we're also trying to, I'm also trying to monitor how many of those recovers are coming out of that as well, and how many of those that are in the hospital side. One of the things I will say is our, unfortunately, you got to look at of the 7% as well. What is the number of those hospitalizations that have come out? We haven't been able to see that number yet because we've just started seeing the hospitalizations really start. So I'll also be monitoring of the 7%, what's the percentage of those that are going to be discharged from a hospital, and what that time frame looks like as well. Are these individuals staying in the hospital for 4 days, 5 days, 7 days? That also is very important as we're looking, because the amount of time that one needs to stay on that ventilator is what's tying up the equipment.
Sure. No, thank you. Yeah, because I just kind of following the numbers with you and walking through it. If 100, were to get tested, the statistics are showing that 8 to 10 of them are probably positive, and then if 8 to 10 of them were positive, there may be 1, maybe 2 that might need resources beyond self-care. Just to try to, so again, with every 100 people, every 1,000 people, every 10,000 people,
Sure.
Those numbers obviously substantially grow. So I just kind of wanted to make sure that our numbers were tracking with those in the greater metro and across the state, and that I wasn't using bad assumptions there. So thank you.
Anyone else have any questions, Mr. Miller?
I have a couple questions. When have you projected, or is there any kind of statistics saying when the peak will be in our Kansas City region or in Leavenworth County?
The peak is still scheduled for mid to late April is what,
April 19th.
I'm sorry?
I think April 19th is the last one I saw.
It's from April 19th. If you look at it, it's from April 19th, kind of that week. Again, it's not a just on this one day will be the apex. It's more of a how many of those days will maintain at that. So again, I think around the 19th is a fair assumption. What that's going to look like, those will be the projections. And again, that is a lot of that data, even from the national level all the way down, is changing multiple times a day. So these projections are, I want testing. I mean, the only way to do that and get accurate for our area is to be able to test. And one of the things.
Speaking of testing, I've been reading about antibody testing, that there's a different type of testing that they're talking about when we start getting ready to have people, when we start coming out of this, that we can use the antibody testing to kind of determine if you have the antibodies, then you probably aren't going to get it again. Any word on when those kind of tests are going to be available?
There's not for us. Not yet. I have not heard anything yet as to when that's going to be available at the local level.
Okay. The flu season was pretty intense. Do we know how many deaths there's been in Leavenworth County over this flu season?
Quite frankly, Commissioner, I have not had the opportunity to pull those type of ILL numbers.
I just wondered if it compared with...
I haven't as of right now. I haven't had the time.
Okay. The other thing was this published criteria for grading the counties. Is there anywhere that the criteria they use to determine?
Unicast?
Yeah, is there anywhere that criteria is published so people can go online and look at it?
If you go on and look at the Unicast website, it gives all the criteria of how they, what the formula is and what, there is a lot of error rate, obviously, in that. It's not a perfect scenario. It's not a perfect, so again, I can only use what's available to me. And what I can also do is look at what here in Leavenworth County, major Walmarts, Dillon's, areas that you can drive by, grocery stores, you can drive by, and when parking lots look the same before the order as they have after, and then you look at the grading scale of that, it's a pretty high that is probably matching what the grading scale is based on people are still, we drive by golf courses, you drive by, and they're packed, and there's people are not utilizing this necessarily to, I think those that are compelled to stay home are staying home, but I think a lot of people are still using this as, well, I'm not that scared of it, and I'm going to go out into the public and still go golfing. I'm still going to do things. I'm going to go to the store, even though it's not an essential function. And that's what is creating, I believe, the numbers in the grading scale of that F and D minus and D. Because, again, the biggest thing is it important enough? And we keep trying to stress that over the health departments. What is truly essential? And it really, if you have to ask yourself, is this essential? It probably isn't, is the biggest thing that I can say. Is it essential I go to the grocery store right now just for this? Or am I going to the grocery store and getting a full week's worth of groceries for one trip, one person, one cart scenario on an exposure? And we're not seeing that. There's, well, I'm going to swing in, I just got to pick up that. Well, that's not going to help if you're going to the grocery store every other day.
I just wondered if the low grades, which my understanding is those grades were not established by the state of Kansas. That's established by this organization.
And Secretary of KDHE even said that. He came out and said exactly where he got those numbers from and what they're using for. It's just a tool in the toolbox, if you will, to help grade where the movement is. And the nice part about that is that's trackable from, they're taking the same data now from those same phones and same everything from weeks prior of what the movement looked like. So you can go against that, and that's what the grading system is going off of. It's not just going off of what did it look like 5 days ago. They can track that data months ago on normal movement of how our community looked like months ago.
I just wonder if it tracks with the urban counties. Like I haven't really studied that, but are the more urban counties in Kansas getting lower grades than, say, the rural counties out in western Kansas?
Well, when I looked yesterday, was it Johnson County or Wyandotte County had a C. So, there's a lot more people and a lot more movement there. Are more people staying home? Things are shut down, abiding by? I don't know. I don't have all the answers to that. All I can tell you is it's another tool in the toolbox. And the biggest thing I can stress from the point of health and transmission of a virus, social distancing. You can't stress that enough. It's the whole purpose behind all of the orders, everything that we're trying to do. Why are we not having a full commission sitting? It's the social distancing to relieve the ability of passing and transmitting that virus. And the more that we can do that, the quicker we can get through this. And the more compliance we have, the quicker we can get through this.
I will say I do sense out in my area, in Tonganoxie and out in, down by Sherman Township, there's a lot of people that I do believe, I mean, we may be getting a D or an F, but I know a very, very large number of people that are complying and are trying to do their very best to not be out, and I think we are getting a lot of compliance.
Well, Jamie, this is Commissioner SCHIMKE. There's no doubt that everyone could and should be doing better, and I'm not as familiar with some of the grading that you're referencing. I did have a question just as a percentage, though. Is it kind of unique given we have, Fort Leavenworth, the VA Medical Center, the correctional facility? I mean, we've got a lot of employers that fall into that essential or critical category. And so I don't know if that skews us at all being we're not a huge community, and we have so many of those employers that fall into that category. I'm not trying to say that we're doing a great job. I'm not trying to say we shouldn't be doing way better, because that's the case across the board. Even if you have a B or an A, you can be doing better. I just wondered if some of that doesn't skew the numbers, because, Fort Leavenworth's excluded on a lot of the things we do, yet, they employ, 10,000 plus people that reside across the state, across past the county. I mean, that's just one of several that I mentioned, so.
And Commissioner, with the limited amount of research I've done into what the algorithm looks like and such, again, it takes into account certain geographical locations and things on what the normal movement to those are, and takes then other locations and movements of that same phone going to other locations versus going to use the prisons as an example. If that phone over the last 3 months went from this spot to the prison and back home, they would consider that an essential function or essential. But when that phone now pings into 3 other locations instead, that's where they're pulling some of that data that the individual is not staying home or going from point A to point B. They're going to all these other locations, and that's where some of the unessential things start to play into the equation or the algorithm. It's not my website. It's not my data.
Right. Yes. And sorry for the questions, and I don't expect that to be a part of your reporting and/or job. I was just more bringing it up for the anybody that's watching and the rest of the commission to ask those questions.
And the main reason, Commissioner, I even brought it up is because, again, the state has been using some of this data out there, and I wanted to explain here of where and why. And again, Lee Norman does a good job of explaining a little bit in his video and why why he used the numbers and such, as well as just another tool in the toolbox to help prove and show to people we're still not 100% abiding, probably not even 50% abiding to what is truly essential and what's not essential. As I can, there are a lot of people out there, Commissioner Stieben, that are hunkering down, trying to do the right thing. We talk to them on the phone. I mean, they're calling in, they're abiding by quarantine orders, but I can also assure you that there are a lot of emails that come into the JIC of this is happening, that is happening, these aren't happening, why is this not being shut down, why? So we are seeing on the back side of it the full gamut of the other side of the table too, that of the individuals within our community that aren't abiding by the stay-at-home orders that are placed out by the governor.
Well, I'm sure, and this is Commissioner SCHIMKE again, I'm sure, Jamie, you can appreciate that, we get phone calls and a lot of inquiries, and there's a lot of people that are uneasy about being tracked in general. I don't want to get into any of that necessarily. I get your point. I think it's one more tool in the toolbox that you guys are leveraging to manage the situation. But, when you represent the county, you get a lot of people that have a lot of concerns in general, right?
And I think it's important that everyone understands that anyone in the public can go to that website and get the same exact. This is not anything special that I have access to or that the commission has access to or anything else. This is general website information that you can go to Unicast and get that information.
I have been getting some phone calls about concerns that people have about their civil liberties and about the monitoring of movement, and it is a public website, but the question that people have is, how should the government be interfacing with that?
Any other questions I can?
Any other questions, Mr. Miller?
Thank you for everything you did. I really appreciate it.
Jamie, is there anything we can do to help you? Letters requesting anything or changing any?
Like I said, the next big piece for me will be once I understand what the testing is going to be, if there's a financial piece to that or whatnot, I'll be bringing that obviously back. If it's something within my realm that I can already take care of, then it will be a reporting piece. If it's something that I believe, then it will go to Mark and I'll bring it back in front of the board on a decision.
Yeah, and you don't have to wait for that. You know that already.
Sure.
You can just get a hold of Mark, and whatever you need,
Right.
we'll make it happen. So.
This is Commissioner KAAZ. I just wanted to take the time to thank Jamie and his team for all of the hard work that they have been doing, and to just, I cannot thank you guys enough.
Thank you.
I agree. Thank you. Thanks for taking time to come in here and updating us.
Thanks, Jamie.
Thanks, Jamie.
I do have a question for County Councilor. On the governor modified her order yesterday. Could you kind of reflect on what that modification is?
Commissioner Stieben, Governor Kelly did issue Executive Order number 2018 yesterday. I have had the very brief opportunity to discuss this with the county administrator. I believe he may at this time have a greater grasp than I, and I defer that question to him.
The county health officer and I have discussed it last night and this morning. The new order basically clarified funerals and churches. That were the primary changes in our new order. But if you read through it, which it gets confusing because they've put out several orders and you don't know which ones. I wish every time they put out a new order, they would just restate everything and that would be the order, and so you wouldn't have to reference two other orders at the same time. The 20-16 order still is in place. That's the stay-at-home order. And that will remain in place until the 19th. At this time, nothing's changed there. The restrictions that were put in place with that order stay in place. The only thing that they did was clarify churches and funerals for the most part. After her order expires on the 19th, they provided more guidance that goes to the end of the month. So that's really the new part of it. And also in there, they clarified that our orders, local orders that are more restrictive, will stay in place. This is, again, we talk about statewide versus local jurisdiction. So her order is a statewide order, and there are certain areas of the state that do not need the same restrictions that we maybe need in the metro area. That's why they put this order out. But I also think that there was confusion across the state that some communities were reading her previous order to mean churches and funerals couldn't happen. And so that's why they clarified it, that said you can still have church, you can still have funerals. The staff members do not count as your limit of 10. You can still have the 10 people for the social distancing matters. But our order that was, her order from the 20-16 is still in place. It stays in place till the 19th. After the 19th, this new order goes into place, but our local order will kick back in on the 20th. And if it's more restrictive, our rules apply.
And that can change next week also.
That can change as this one changed. You know,
Right.
that was out for 2 weeks, and then a new one came out. So with that, obviously, between now and the 23rd, our order could change. Between now and the 19th, the governor's order could change. So it's kind of fluid. As the county health officer said, things change every day with this.
Okay.
I think a lot of times recently people are questioning, you know, this whole division between essential and non-essential. I think they're, you know, some of the things that are, you know, we wait till Easter week to focus in on the church issue, and then the governor's fine with flying abortion doctors in from California and Illinois. That's essential to her. So I think some of the criticism has been that the actual, what the deeming of essential and non-essential has been. I think people are somewhat concerned about that.
Anything else before we move on to the consent agenda?
Well, I wanted to bring one thing up during administrative. You know, since this is an invisible foe, a lot of people can't see where it is, and unless they're personally touched by this with their friends and family, it's hard for them to take it serious. Good example of this is lots of phone calls that I got about the transfer station. A big line backed up yesterday morning. It was a 2.5 hour wait. And at first I thought, well, maybe we need to look at this and see how we can alleviate that problem. But more and more, the more people I talk to, what I'm figuring out is everybody's stay-at-home order, they took advantage of that for spring cleaning their garage or spring cleaning their yard up. And then they did it over the weekend, and then everybody showed up Tuesday morning to the dump. And then they're mad because they got to wait 3 hours. So the stay-at-home order, only do essential business, does not mean do your spring cleaning and then take everything to the dump Tuesday morning. They can do it, but they need to have a little patience. I mean, this is some new territory for all of us. So if they expect to have things operate like normal, why is there a 3-hour wait? That's because we have a corona epidemic. The situation merits, the way things are playing out. So don't take advantage of the time you have to stay home to do your spring cleaning and then take everything to the dump on Tuesday morning, is my point.
And we're also not fully staffed, correct?
Yeah. Commissioner Culbertson, thank you for bringing that up. I should have touched on that, actually. Last week, we saw a huge increase in the number of people coming out to the transfer station. I think as the stay-at-home order kicked in statewide, more people were home, and they were taking advantage of it to do exactly as you said. It became the countywide cleanup week, which has extended into multiple weeks. We've encouraged people to only use a transfer station for your essential service, like getting rid of your household garbage, if you don't have somebody who hauls that for you. In the meantime, we do have the commercial haulers who are hauling household garbage from around the county. They're trying to get in and do their business, and they have to sit in that same line, which is 2.5 hours long. Last week, we made the decision that we needed to limit the residential traffic out there in the mornings so our commercial haulers could continue to function. We put that out over the weekend on social media, on the website, and yesterday, obviously, Tuesday is the first day the residents could get back in. People were trying to learn that, or they were learning that it was closed to residential traffic. So until noon each day, we have restricted it to commercial haulers only, so that those folks can continue to try to conduct their business, and they serve hundreds of people versus the guy who's wanting to haul the deck that he tore off in the weekend or the trees that he trimmed back. So that did change. We also went to a no person-to-person contact out there, so the people are staying in their vehicles. When they come in, they're paying over the phone. They do have a card swiper on the outside of the building, but we're not taking any cash transactions either at the transfer station at this time. And again, we just encourage people, it's stay-at-home order, stay at home unless it's essential. Essential is not your annual cleanup.
And is the definition of commercial customers anybody who has a business, or is it a commercial trash hauling business?
So it'd be commercial in two ways. One, the commercial trash haulers, the guys who have the big trucks that are going up and down the road, the brothers and those guys like that. There also are the landscapers and that kind of stuff that was labeled as essential, that they are, anybody who basically has a charge account with us is commercial. So that's not necessarily commercial that I own Joe Bob's.
So it's not just any business.
It's not just any business.
It's commercial to do with trash hauling.
Yes.
Okay. Because that's a confusion too. They're like, well, I have a business. But when we say commercial in the morning, we mean trash hauling.
Yes, you're hauling refuse commercially.
Okay, because that was a big confusion too.
Yeah.
They thought since they owned a business, that meant they could go out there in the morning. So I wanted to make that clear too, that it's trash hauling commercial business is who gets in the morning.
But those who are commercial that do the commercial hauling have accounts with the county. They don't pay each load. We track the loads and bill them. They know who they are.
Okay.
If you don't have one of those accounts, then you are not commercial hauling.
Okay. And you don't get one of those if you just have a automotive business or it's a trash hauling commercial business. Okay.
Question for the county councilor, and then for Mark. What is the governor has her order issued? What's the enforcement mechanism for that?
Commissioner, the governor's executive order is authorized by certain state statutes, and under the general powers granted to the executive branch under Article 1 of the Kansas Constitution, it could be enforced through a court order, which under the circumstances I would suggest probably would not be the more immediate means of enforcement. I don't detect, nor have I, from reading this order, gained any appreciation that the governor intends to either bring out the National Guard or the Kansas Highway Patrol to enforce this. I think it is more, at this point in time, a directive to the population to abide by that order. It is a lawful order, and just as we all abide by the law, even without the peril of immediate arrest, I think that's the general hope that the order would be abided by. It could be enforced through criminal prosecution. It'd be a Class U or Class C misdemeanor, but I think the intent is that it would be voluntarily complied with.
Yeah, I think that's right. I think private decision making always is better than public decision making, and if we all decide to stay in, don't go out, keep yourself safe, especially keep your elderly people inside, and just observe the social distancing. I think that's important. The other thing I was going to ask about, there's this article I read in the Wall Street Journal. It said, How to Get America Working Again, and this is for Mark. Once we hit the peak and we begin to look at maybe unwinding this and looking at having public hearings again and opening up government and opening up our community basically again, how do you anticipate at this point proceeding? Will it be the same? Will we be kind of unwinding it in a way like we would go to 10 and then we'd go to 50? And how do you see that happening?
Yeah, I think just like it ratcheted up, it'll ratchet down. So our first step, I think even though it's only been a few weeks, it may be hard to remember, the first step was they came out and said no gatherings larger than 250. And then like the next day, I think it went to no gatherings larger than 50. And then by the end of the week, it was nothing larger than 10. So, and then obviously we're at the stay-at-home order now where unless you are a certain facility, you can't have anybody in there. I think you'll see the same thing where it'll go slowly release it back to 10, and then from 10 maybe to 50, and then sometime late in the year it might be back to the 250. But I think what we've learned from the coronavirus in general is that social distancing matters. And I just saw a thing on the news last night about China has opened back up some of their stuff, and they had people standing on top of each other, tens of thousands of people standing in line because they had a large national holiday over there. I would hope that we do not get back to that anytime soon because this could kick right back up, and it's going to be interesting to see what happens in China over the next 2 to 3 weeks after this holiday weekend. Hopefully we learn our lessons from others who learned them harsher than we did, but I think it'll be a slow ratcheting up. I don't know that we'll ever have where this room will be completely full like we've had in the past. I think we will limit it to people who have seats only, and we'll try to maintain distancing just to keep people as safe as possible.
I think people are really concerned about their businesses and their economic.
They should be.
Another question I had, Mark, was car tags. People are asking about car tags. They're still able to do them online or mail in, but there's a lot of situations where that's not possible if you need an inspection or one you didn't get a renewal on. And it was said that they're allowing 90-day past your expiration date on your tags.
What had come down from the state is actually that once the offices open back up, they will allow 60 days from that date. So whatever that day is, they will allow an additional 60 days. That was the governor's order. I think that was in, well, I'm not sure if it was part of 16 or not, but that came down from the governor's office. And we had been asking for that for a while because we knew the challenges we were having, and they did authorize that at the state level. Last week, I think you heard the treasurer report that the renewable tag, when you're renewing your tags, that's not a problem. You can still do that online. It's the new plates, if you buy a new vehicle or if you bring a vehicle from outside the state that needs inspections, well, the inspection offices are still closed right now, I believe, so you can't even get the inspections done, and that's at the state level, not us. But the last message was that after they reopen, 60 days from that date, you would have to get your stuff taken care of.
But if you have a tag that you can renew, it needs to be done on time?
Well, I would encourage everybody to keep up on that as much as possible, but I do believe that order covered all plates, because it's hard for the officers to know as they're driving by, is that a new tag or is that a renewable tag?
Okay, and that's what I was getting at, is there a way we could ask for something in writing? I don't know if they'll give it to us or not, from local law enforcement about expired tags, how they're going to handle it.
I believe the treasurer said that she had spoken with the sheriff on that item.
Mr. Chairman, members of the commission, it's my understanding local law enforcement, particularly the city police departments in Leavenworth County and the sheriff's office, are well aware of the details of the extension grace period, if you wish to call it that has been granted to drivers, and they fully intend to comply with it. And I don't think the citizens shouldn't anticipate any interference by our law enforcement.
Okay.
Again, I think, like I've said in the past, there are those tags that were expired well before any of this started.
Yeah.
I do not believe you get a free pass on those.
No, if it was expired
January 1
last
is what
year.
the governor said. Obviously, here, we didn't shut stuff down until the middle of March, so really, January, February, I don't know if I would expect a free pass, because you could have gotten in and got that taken care of.
Right.
And I need to interject again, please. This is Commissioner KAAZ. The commissioners need to speak in their microphones or speak up just a little bit. Thanks.
Okay. All right, anything else before we move on to the consent agenda? Then we'll move on to the consent agenda. Has everyone had a chance to look at the consent agenda? Is there anything that needs to be pulled out and voted on separately, or can we just approve the consent agenda? Then I'll entertain a motion to approve the consent agenda.
So moved.
Second.
Have a motion and a second. Any further discussion? Voting?
Aye.
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 Commissioner KAAZ votes aye.
Commissioner SCHIMKE votes aye.
All right, thank you. Okay. All right. Are we ready for any discussion on the county clerk's letter? Has everyone had a chance to read this? And do we agree with what's stated in it?
I agree with it, but I think I only agree with it in terms of the virus. I think
That is correct.
And that's
This is not permanent.
right.
This is not permanent. No.
But I do want that to be out there, that I think that we are not going to go to permanent doing mail-in elections, even if they would adopt this. But I think a lot of people still like to go to the polls on Election Day. So, but yes, for this emergency situation.
Right. That's all we can do, because, I mean, it's just the timing of this. We've got to have something in place. We can't come along July and say, hey, we can't do this. So
I did talk to the clerk about, there was during the tornado, there was a group of Boy Scouts that they're based downtown. Told them, I'm sure that they would be, getting some younger people to help with the polling places, help to man the polling places would be.
You'd have to have 18-year-olds at the very least.
Right, but there's a good number of them that are available, and I think that's what we get the younger people so that we don't have the older folks in there.
Didn't Janet say she hires 250 temporary people?
I know
It was a lot.
I don't remember that number, but I think there's other challenges other than finding people to man the polls, is that we're then encouraging everybody who's on a stay-at-home order to get out, and at the time that, maybe by that time the stay-at-home order will be lifted,
Yeah.
we're hopeful, but you're still encouraging people to get out when we probably shouldn't be.
Yeah, and even if it's clearing up, then you got to order the supplies to have them on hand to do it. So
I think she's talking about maybe limiting the number of polling places, like reducing it down to.
So that's going to put more people at the polling places.
Closer together.
Yeah.
Right, but the fact is, even if we write this letter, that doesn't mean that.
It's going to happen.
Right, So, I mean, so yeah, we should sign on to the letter,
And then
but
what?
but do I think the Secretary of State's going to do this? Probably not.
Yeah.
So is that your motion?
Yes, that's my motion.
Have a motion?
This is Commissioner KAAZ. I just have one question for our county counselor. Is it okay that my name is not spelled correctly on the document?
No.
No, it's never proper that your name be misspelled, Commissioner. And I'm sure that can be cleared up administratively.
I amend my motion to spell her name.
I was just checking because I'll sign it either way, but I just wanted to say that it's not spelled correctly on the document.
We will make sure the clerk gets that corrected, and it'll be available for signature here at the, Becky will have it out at her desk for you all to sign the corrected version.
Okay.
Thank you.
So,
There will also be multiple copies because each representative will get one of these. So.
okay.
Motion was,
To adopt with the corrected spelling of Vicky's name,
Second.
the letter.
second.
Have a motion and a second. Any further discussion? Voting?
Aye.
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 Commissioner KAAZ votes aye.
Commissioner Shimke votes aye.
All right. Thank you. Okay. All right. I think we are ready for Mr. Knoll. How are you today?
Good. How are you guys doing?
So far, so good.
For today's discussion, we have a request for board action with the gravel road dust control policy that was discussed last week. It is the same policy that was before you then with a few grammatical corrections. I don't know if the board has any specific questions regarding that policy, but
We should have had this when I was a road and bridge superintendent. But that's water under the bridge, I guess. Commissioners have any questions of the document?
Bill, this is Commissioner Shimke. Just a quick question. I just wanted to make sure that, anybody that has... Okay, thank you. That's great. I just want to make sure anytime we're amending or making changes, I got to think of those people that are currently maybe have expectations, and while we're making improvements, it could have potential impact. So that was my only concern or question. I love the direction. Thanks again.
Any other questions, Mr. Knoll? I'll entertain a motion to approve Resolution 2018-11.
2020-15, I believe.
So moved.
I think that there's, in your analysis, there was a referencing the old policy. That's what you're seeing there.
replacing that.
But,
Okay.
So it would be
So the
resolution
2020, which?
2020-15.
-15. Okay.
I just had a question for discussion
All right.
about the chemical dust control portion of this. So the new system that we're going to, prior years, the county would go shape up the road, grade it, and water it right before the chemical dust control was put down.
We stopped the watering quite a few years ago.
You did, okay.
Yeah.
That was one of the questions.
Back when I was in.
So the logistics of this now, if somebody wants this done, the third-party vendor was supposed to coordinate when they do this with the county's regular road maintenance so that we weren't mobilizing, equipment to go out there and specifically for a 300-foot section here and a 300-foot section there, and it ended up being like 90 a year or something like that. We would go out and do, I don't remember what the number was. So we wanted to get away from that part and have the third-party vendor coordinate when we're going to be out there anyway. So if we're going to hit your road, how is that going to work? I mean, because what I'm hearing is the third party's not going to pay attention to when our regular maintenance is. They're just going to go do it when the person orders it. So
So the way it works is the individual would contact the third-party vendor who provides the chemical application. It's at their discretion, the company, that they contact the county and work with us on when we're going to be in that area anyways doing work. If that doesn't work in their schedule, then they can go out and put the chemical application down and let us know so that we don't tear their stuff up necessarily. But there's no, it's on the vendor, it's not on us, and it's not necessarily at the property owner's request either. So it could be that they just go put the chemical down with no additional road work in that area beforehand.
well, typically we're going to hit every road within a certain time frame anyway. So it's not unfeasible that they could work that out, right?
They could. They absolutely could. They could delay when they go and put the chemical in, or they could coordinate by set quadrants of the county on how we're working. But I can't tell you that that's what they're going to do because they're third party. I could tell you that would work if they would do it.
Yeah.
You know what the average is? We hit every road?
And do you, well, it depends on what month it is.
Right.
Now, if they're delayed in getting the chemical down, say, end of June, first part of July, the grader operators are working asphalt. So the chances of the road getting shaped then is pretty slim. But like, say we get a rain this weekend, I'm sure they're all going to be out next week blading the roads when they got the moisture.
So typically in the spring,
The earlier they would get the chemical application down, the better off, probably the better shape the road's going to be in.
yeah, and every road gets hit
Right.
within 3 months, 2 months.
Oh, yeah, more than that.
Okay.
Well,
6 weeks.
But once they start the
Changing
asphalt
it.
work,
Right.
then you're very limited on what roads are going to get bladed. Plus, it's usually
Okay.
too dry to blade anyways.
Right. Okay.
Yeah, and I would elaborate that I have not personally seen the document provided by one of the third-party vendors, but it did lead to the speculation that they were going to apply them in the same fashion that they had previously done in Leavenworth County, where they do a lot of them within about a week period.
Yeah, they're going to bring a tanker load and
They're going to bring it
just hit them,
Do them all.
do them all at the same time.
Okay.
more or less from what has been relayed to me from public concern was that they're going to come in and just apply it as if it was a regular cycle schedule and disregard any county maintenance.
Okay.
And just leave a list so that they can mark it so they know not to blade over them.
Okay.
They'll mark each patch.
With the
dust
signs
control
up.
sign,
Yeah.
Mhm.
Okay. Makes sense.
Okay.
Second thing.
All right, so we have a motion and a second. Any further discussion on the resolution? Voting?
Aye.
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 Commissioner KAAZ?
Commissioner KAAZ votes aye.
Commissioner Shipke?
You vote aye.
Okay, thank you. Thank you.
Thank you.
Thanks, Bill.
Did we get our bids? Was we letting a bid this week on the bridge? If you got a minute.
Yeah.
Okay, I know we've kept you here pretty long.
Yeah. No, I'm all right.
All right.
Talking about E58.
Yes.
Assuming utilities are moved.
E58.
Water line.
Yeah, so the water line relocation is complete on E58. Currently, CenturyLink has a telecom construction contracted company out there working on the phone line. They have a projected completion of the end of the week, maybe the first of next week, depending on weather. The 9th here, we have a pre-bid meeting. We've sent the bids out. It's on Drexel. We sent it out to a list of approximately 30 contractors, which is a more comprehensive list than we've previously been using. And so we're have an anticipated meeting tomorrow. And then May 1st is the opening. It will be on GoToMeeting. So if the commissioners would like to attend, we can get all that information out before May 1st. Probably try to do it. Generally, these are sealed, and so we had to switch the delivery method of that. Bids are going to be accepted through certified mail or by personally contacting me, and I will meet the individual representative from the company on the steps of the courthouse and take theirs. We'll probably try to open them. I haven't been on a go-to meeting with a webcam, but we might try to run it off of a laptop with a webcam so people can see me physically opening them up the bids, because that is always the question. If the public isn't involved in we'll have a couple representatives of the department there, probably at least an additional person, but try to physically open those on camera. And then, so that's pretty much the status at E58. 178th Street, we did receive notification this morning. We've been working, trying to get the notification back from Suburban Water regarding their crossroad connections with their water meters. And so they did verify that they are out of the way for the project and shouldn't have any conflicts. And so that's the final utility that needed to be verified for that project to be let as well. So whether that makes it out to the public today or not, but that project is currently had all the verifications and is ready to bid or go out to bid. And so we'll be working on that here this week and try to get that project out to bid as well.
Sounds like everything's going well then.
If
we can get some contractors to bid.
Yeah, we sent it to 30. That's pretty good.
We sent it out to I brought over a previous master list, and so we sent it out to a bunch of additional contractors. A lot of them would be subcontractors who might want to bid the work, but not all of them are bridge builders, but we sent it out to a much larger list this time.
Just so we get somebody to bid on
We
it.
just got to get some
sounds
bids.
better. Yeah.
So.
Have we heard anything more on County Road 1 warranty?
The warranty?
Yeah.
Yeah, so I met with, which was in the update, I met with the representatives of Cutler Paving and discussed the situation with them. And then subsequently on Friday, I met with the designing engineer from BHC. And what was determined from that discussion was that we were going to, they have a on-call contract with Terracon, and so they were going to get Terracon to come out, or they were going to provide us a cost estimate, probably be a few $1,000s. I think it would be money well spent, but to do a few borings at crack locations. I was going to choose a few, maybe one or so on the very north end, probably a couple just south of the turnpike. I kind of think that that's one of the areas that has the most extensive cracking. But we'll do a core, and so that will determine, you can't tell necessarily what's going on subsurface. And so it's an opinion until you have that actual core sample of whether that's deflective cracking and you had a subsurface issue that this application didn't address.
Or the material itself.
Or if it's the material itself. And so until that point, it's an opinion of a person until you have that physical evidence that can be tested. And so that will give us an indication of whether if it's an old crack that's deflected up through the surface, or whether there is a deficiency within the
Mm.
surface asphalt.
Remember when we took over Santa Fe Trail, and it buckled, the new asphalt we put down buckled every 100 foot like clockwork. It was a buckle up, and it was determined it was the application of a sprayed on oil or something. That was the cause of it.
Well, we kept it crack sealed up really well, but at the same time, it just kept getting kicked down the road. It should have been done several years ago.
We actually, I think it was crack sealed just previous to this project, because I have a bunch of photos that have been provided of.
Looked like a road map, didn't it?
Yeah, and
We had plenty of crack seal on it.
A lot of wheel rutting cracking that was going on with it, maybe is what it kind of indicated. But these cracks are a little bit different than
Right.
in nature than the original cracks. But that's not to say that necessarily that the cracks that we're experiencing now weren't the major cracks from before, so a boring will tell us that information.
Yeah, well, it was brought up years ago that we needed to do something, and it just kept getting kicked down the road. Finally, this board did something. So.
Yeah, and it'd be my opinion that we start with 3 or 4 borings, and then if you get an inconclusive amount of data, we can always do additional borings. If you have 2 and 2, where you find that 2 don't have subsurface cracking and 2 do, you might want to do some further investigation in the future, but it gives us a starting point.
Okay. Any other questions, Mr. Knoll? Thank you, Bill.
All right, thank you, guys.
Thanks, Bill.
You wanted to bring some.
Thanks, Bill.
Thank you.
Okay.
Mr. Chairman, members of the commission, with respect to County Road 1, I believe everybody on the commission is familiar with damage that was done to County Road 1 by a private vehicle in 2019. I have been in discussion with the insurance carrier for the individual responsible for that damage, and I believe we've reached the end of productive discussion. I would like your authority to proceed in a legal action against the responsible party to recover the actual costs of the damage incurred to County Road 1.
I believe that was a $13,000 change order that we had to.
Commissioner, the actual eventual repair costs were approximately $11,500. The insurance carrier has declined to pay that amount to date.
Of course they have. Okay.
This is Commissioner KAAZ. I would support moving forward with recovering.
We just need a consensus on this? Or would you rather have
Commissioners,
a
a
motion?
consensus would be satisfactory. I would like to have a vote on it because I do intend to inform the carrier of this impending action.
Then I'll entertain.
David, this is Commissioner Schimke. Just a quick question. I'm assuming you can handle all this litigation internally, meaning we're not going to spend $12,000 externally to retain $11,000?
No, Commissioner. It can be done internally.
Okay, thank you.
So did you have any response at all from the insurance carrier, or what was their response, that they're not responsible, or?
We've had numerous discussions. It's not an issue of responsibility. It's that the carrier has declined so far to pay the actual or offer the actual costs the county incurred to repair the damage. They've offered lesser amounts. And in discussion with the county administrator, we believe the cause of the damage is very clear. We have the actual repair costs, and we feel it unfair to the taxpayers of Leavenworth County that we accept a lesser amount from the responsible party's insurance carrier.
Okay. Then I'll entertain a motion.
I move that we authorize the county councilor to move ahead with litigation to recover damages on County Road 1.
Second.
Got a motion and a second. Any further discussion? Voting?
Aye.
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 Thank you, Commissioners.
Commissioner KAAZ,
Commissioner KAAZ votes aye.
Commissioner Schimke votes aye.
All right. Thank you. All right. So we're ready to move on to public comment discussion.
Only item I had to bring up was about the dump. I already did that, so.
Okay. Public comment discussion on this material.
So this is something that the Board of County Commissioners has discussed a couple of times over the past several months. At the last meeting that we discussed this, there was direction or request given that Commissioner KAAZ try to track down what some of our neighboring counties, how they handle it. I think you have a pretty lengthy list, 44 counties that responded, and you can see that it's kind of goes all around the bases here. So I think it's at the discretion of this board how they want to conduct your meetings. I think Commissioner KAAZ probably has more information about this than even I do. So this is a policy decision on how you conduct meetings, and that's my part of it.
And I just wanted to bring up again, before we start talking about this, that I don't think a lot of people understand that the actual Kansas statute says we have to allow people, the public, into our meetings, but we do not have to allow them to speak. So I just want to make it a point that Leavenworth County wants to hear the public speak when we're trying to figure this out. This list that she came up with looks to me like half the counties out of these 44 don't allow public comment. So they're following the statute. They allow people to attend a meeting, but they don't allow them to speak. About half of the counties on this list do not allow public speaking. About a quarter of the counties let them talk in front of the meeting, and the other quarter let them speak after the meeting. And there's several that will let them speak if they get on the agenda. So it's not really a public speaking time. It's that they're on their regular agenda anyway for their public comment. So I just wanted to point that out before we get started.
This is Commissioner KAAZ. There's also several of the county commissions that do allow for public comment, but they follow a very strict time schedule, and public comment is put in at a specific time on the schedule, but that was something, my understanding is, that Leavenworth County moved away from.
Oh, you mean like a total of 15 minutes for all public comment?
Lyon County does that.
I mean, they have a very specific schedule for the Board of County Commissioners. A certain thing happens at a certain time, and throughout the day or throughout the morning, and they adhere to that schedule, which my understanding is Leavenworth County used to do, but moved away from.
Probably to be more public friendly, to allow people to speak their piece, I think is what we've moved to.
Right.
Jeff, sorry, I was having a little bit of trouble hearing you, but yeah, it seems like the county, and this is Commissioner Schimke, has gone full circle on this a number of times. And Vicki, thank you, because I know you put a lot of work into figuring out what other counties are doing, and more often than not, I feel these are instances where you're probably trading problems. I think if, from policy perspective, if we're able to manage it to a certain set amount of time, which we've had a lot of dialogue and discussion on, and make it specific to items that are on the agenda. Anybody has the ability to call, email, snail mail, request to be placed on that agenda in regards to a specific topic. But I don't know that we'll ever find a solution that appeases everyone. All we can do is manage it to the best of our ability. And I do think people that are on the agenda, that take time off, that make the trip in here, depending on where you're at in the county, it could be a good 45 minutes to get here. That all needs to be taken into consideration, so to get them in and get them out and for us to move on, I think makes the most sense. But that's just my 2 cents for what it's worth.
So Commissioner Schimke, so you would be in favor of, say, starting it at 9 o'clock and putting a 15-minute maximum on it, and then our agenda could start, our regular agenda items could start?
Yeah, I mean, I'm okay with us setting a maximum amount of time so that the meeting can take place as the agenda that was presented. So if we want to put a cap in 15 minutes, that's not a bad recommendation. Again, my argument was more to, we've got a certain number of minutes that's already been identified, per speaker. The speaker must already be on the agenda. And if we're to say in total that time is not to exceed, 15 minutes, then that's fine, and they have the ability to be on the agenda again.
Okay. Any other thoughts?
Well, I had indicated my personal preference would be moving it to the end, only so that there would be less of a time limit on the amount of time people could have to express their concerns or opinions. However, I also kind of like the way that Atchison does theirs, where they have a short period of time before the meeting, and I think that it's 15 minutes, and then that individuals can then again, if there's any unfinished time or business for public comment, that it can take place at the very end of the meeting.
Okay. Well, I think that at the beginning of the meeting, we need public comment for agenda items only at the beginning of the meeting, that may be the only opportunity that they have to speak on an agenda item that's coming for us. But, and then having something at the end of the meeting for just general statements.
This is Commissioner KAAZ. I could agree with that.
Okay. And are we all on the same page for like a time limit, like say 15 minutes?
I don't think I'm on the same page with this at all. I think I don't think the status quo is broken. I think there are occasions when we have a large number of speakers, but that has not been the norm. I think we ought to be willing to allow any member of the public, give them their 5 minutes, let them have opportunity to speak. And if something's not broken, why do we need to fix it? I think it's not broken because we have a lot of meetings where we don't have excess public comment. We have some where we have had to sit through 45 minutes or so of public comment, but one thing I think is we all learn information from that.
But Mike, this is Commissioner Schimke. I think the idea of thinking is, we've got all types of, if it's vendors, contractors, litigators, lots of different entities that support the county that are on an agenda, and their time is also important. And I'm not saying that it's any more important than a resident necessarily. But the idea being, we're always going to have public hearings. There's always going to be opportunity for those where there's great opposition to speak. So I think we're just trying to identify the business as usual, and if we want to conduct business and do so timely, if there is more comment than we can fit into that, say, 15 minutes, what is the risk or harm of saying, great, we want to hear from the rest of you, we're just going to do it at the end of the meeting, so that the other 5 companies, contractors, entities, you name it, or 25, we can get to timely, and then we can spend the rest of the day here and listen to everything you have to say.
Well, I don't really have a problem with that.
I agree with Commissioner Schimke.
No, I was talking about 15 minutes at the beginning of the meeting to listen to public comment for things that are on the agenda. And then if we have a regular public comment after our meeting.
And I agree with all of you, actually. I don't know if I'm the only one that does this, but usually when I come to a meeting, I look around the room and I add up how much that guy makes, how much that guy makes, how much that guy makes an hour or a day or whatever. And then we usually don't have a problem. Like you said, if it ain't broke, don't fix it. But there have been some days where we've had a lot of money sitting in the audience waiting for 2, 3, 4, 5 hours. I remember one day, 7 hours. We had a lot of money sitting there waiting for 7 hours. And I was thinking, we should probably put them first so that we're not paying them to sit there for 7 hours waiting on everybody. So I kind of agree with both. I'm not saying a citizen's time isn't worth money, but it would make more sense to let them speak on agenda items for 15 minutes first thing in the morning so that you still facilitate somebody walking in and saying their piece, but limit it and then maybe have another session at the end so we can move the expensive audience through so they can get back to work. And then have people talk at the end.
You're only going to have 3 speakers if we keep it at 5 minutes, unless we change it to 3 minutes or, I mean, if you're going to do just 15 minutes.
If they use the whole 5, you're right.
Right.
But then again, agenda items only for the first public.
15 minutes. That way we can stay on our agenda and we don't have people showing up. They know not going to have to be here till 9:15.
I just hate the idea of somebody driving up from Linwood, taking the day off to come up to the county commission, and then they have to sit 2 hours in order for them to say their piece.
Yeah.
And while I appreciate the fact that we do have engineers and we do have people coming from time to time in front of us, I think that also is an exceptional case. And I do think you would have discretion as a chairman. In that case, we could move them ahead of the public comment if we needed somebody to be expedited through the meeting.
So if we gave 15 or 20 minutes for agenda items only and 9 o'clock, and then also have another one at the end for non-agenda items, or agenda items that didn't get a chance to talk, is what I would suggest. So you're doing both? You're allowing people that,
We're still allowing the public to speak.
yeah.
I just don't, I mean, I could work with either of it. It's not like, this isn't like the biggest decision in the world, but to me, if it's not broke, don't fix it. Why change it? But I could live with either way.
Well, I think if we do change it, though, like I said, if you've got an expensive audience waiting for 7 hours, that would fix this. Say 20 minutes to talk about agenda items in the beginning, and then everything else after.
And one of the things that I saw in here, and then also that we usually, or that we are recommending for public hearings, is that they get on they submit their,
Get on the agenda.
whatever it is they have, they submit it in writing before the meeting, and so that we have that to give to the board. And then if we schedule like the 15 minutes at the beginning, I think what the people's big concern is, and I think you all received the email this morning, is that there's going to be something on the agenda that they don't get the opportunity to voice their opinion on before you take action on it. So they don't want to be at the end of the meeting because it's too late. If they would submit that information in advance, they would make sure that you get, just like that email today. Now you all know about that what that person's feelings were. If they would have, let's say this meeting was open and they showed up and we ran out of the 15 minutes, they wouldn't have got to do that. So I would say that it might be good to also encourage that all public comment you sign up for in advance, so that it's not just you get here and you decide you want to have a public comment, but you sign up for in advance. I don't know that they have to provide us with what they're going to speak on, as long as they understand that it's better if they do. We're set those rules for public hearings. Maybe we could adopt some of that for part of the public comment as well, just to kind of streamline things.
One thing I wanted to bring up also while we're discussing this, and it's probably a little bit of a separate issue, is while we're moving forward with all this stay-at-home orders and all these things, I hope that we can figure out a way to have public comment, and maybe the way Mark's talking, maybe if they would submit their request to make a public comment and we limit it to 3 minutes or something, that we could let people be on the agenda for public comment even while we're going through this situation that we're going through right now. I think your suggestion for that would work perfect. I don't know when we actually get public in here. Sometimes it can be a fluid situation where somebody decides they want to make a comment.
Well, I think, again, if next week we're going to be talking about how we can conduct public hearings going forward interactively without having the building open if things continue, so that we can get back on schedule with stuff. But the other thing, if people would sign up in advance and we knew exactly how many people were going to speak, we could allot that amount of time and notify everybody on the agenda that our regular meeting would not start until, if you wanted to have it at the beginning. If you just want to do the 15 minutes at the beginning and then however many at the end, I think that addresses that. But if you did a true sign-up, you had to be signed up, let's say you have to be, we send out the agenda on Fridays. You have to be signed up by Thursday afternoon or Friday morning to be on public speaking. Then we would know exactly how many people we were going to have show up to speak publicly, and we could put a schedule out that shows exactly when they have to be here. So if you're worried about, that, I guess if you're going to still have the public comment at the beginning, we could schedule it down to the minute and say this is your time frame. And I think I saw that one of the groups actually do that. They schedule their public comment like an hour before their public meeting actually starts. It's before a work session or something, but just some suggestions. I mean, obviously, your choice. We'll set it up however you all.
Can we do public comment going forward? Like next week, could we do public comment remotely?
And I think what we had discussed is, and that will be actually a topic next week as a work session item, on how we conduct public hearings. But if people had a need for public comment, if they would contact us in advance with a phone number, we could set it up where we would call them at the time. Then they could provide their public comment, and we could then call the next person if there was a list.
But if we had in writing what the public comment was going to be about, we could perhaps have an answer for them on their issue when they come forward.
Just like we talk about in public hearings, if we have it in writing, you've got a much greater chance of, one, getting a response, two, us being prepared, and three, that all the board hears it.
Correct.
I just kind of like the way we've been doing it in that it's not so scripted. I think if you're requiring people to way in advance, like on Thursday or Friday, submit their request, that kind of forces the public to, maybe they realize on Tuesday before the meeting that there's an issue that they're very interested in, and they would like to have some input, and they want to come over here and give that input. That doesn't give that opportunity.
Well, it does. They just have to wait a week to do it, like everybody else who gets on the agenda.
Well, but if we leave it to status quo,
Right.
it doesn't.
Right.
But like I said, the beginning, I really think should be blocked off for agenda items for people to speak on before we actually vote on something. And like I said, I support having the open mic at the end.
And typically, it's not always the case, but typically when we have agenda items, I have seen the board solicit input on that item when it comes up on the agenda. Mm-hmm. So as long as you are doing that, you've addressed that need. And I think the person in particular who sent the email today to the board, I don't know that other than the fact that they're not here today or in the being able to get in the building. Anytime where it's open to the public, I think they've had every opportunity to provide feedback before, during, and after the meetings. So, that's what I'm saying. I think the board has been very receptive. I don't think you've shut down people who, during the meeting, have had questions on an agenda item either.
Okay. Any thoughts from our commissioners by phone? I'll take that as a yes.
This is Commissioner Schimke. So for what it's worth, my position would be to set a time period. Again, Doug, you recommended 15 minutes. That makes sense to me, so that we can try to the best of our ability, manage an agenda, stay on track, get through it timely, but in no way, shape, or form. And again, I think those comments at the beginning need to be specific to what's on the agenda. But anybody else who would like to attend and would like to provide public comment can do so. We're going to do so after we've gotten through all of our other agenda items. But we'll stay as long as we need to make sure that their concerns are heard and ultimately addressed. That would be my recommendation.
Okay. Thank you.
Mine too.
So Commissioner Culbertson said he would support that if you didn't hear that over the phone.
I'll support that. Commissioner KAAZ, are you there?
Yes, I'm here. I support Commissioner Schimke's recommendation.
Okay.
So that would be
For, is that going to be made into a formal motion?
What I'll do is I'll draft I'll put that into writing, put it on the agenda for next week for formal approval, so that we'd like to have those things on the agenda for when we're going to be voting on them. So I'll put that on for next week.
And just where I'm at, I'm not going to vote for that.
It's really not changing.
I just think I like the way it is right now. So that's why I'm not going to vote. I don't have a problem. This is not like the world earth-shaking issue here, right? But I do want to have, if going forward, if we can figure out a way to let the public, like you suggested, having call-in public comment on a temporary basis until we get reopened. Is there a way we can? How does everybody feel about that?
It'll work.
I agree with Commissioner Stieben that we do need to try to figure out a way of allowing for feedback and
I can't hear you, Commissioner KAAZ.
You were kind of muffled.
We can hear you.
Oh, on PARYS.
Say that again.
I agree with Commissioner Stieben that we do need to find a way to allow for public comment while we are not able to have individuals from the public in
Under the order.
attend the meeting.
We're working on that.
Yeah, that actually is a work session topic for next week. If you don't want to wait till next week, my recommendation would be that anybody who wants to make public comment, provide us something in writing with their phone number, and then we can make arrangements to call them when our time allows, but they would have to be available in that either 15 minutes before the meeting or after, whatever you decide.
Do you want to say what the deadline would be for them to have that into you?
Well, I think if it's just going to be public comment in general, we would need it at least by the Monday. I would prefer to have it on Friday so I know what the agenda is going to look like that week, but no later than Monday.
Okay.
Okay. Anything else? Anybody have any meetings they're going to attend by internet?
Virtually.
I got Bayshore City Council tonight I'll be watching. And that's about it.
I did attend the...
This is
go ahead.
Commissioner KAAZ. I did, by phone, attended the White House briefing last week, and there was really nothing new to offer as far as the COVID-19, but, just what's actually being pushed out on in newspaper and televised updates from the White House.
Okay.
I listened into Commerce Secretary Poland's, and he reflected on they had the hires program that was for hospitality workers and event centers and that kind of thing, and they had $5 million. They issued 346 I don't know what you call it, loans through that program, but there were 1,200 additional people that they were unable to fund, but they did encourage people, if you are in need, go ahead, put your application in.
And when the money becomes available.
When the money becomes available, it'll be on a first-come, first-served basis, and also they're going to be able to measure what the need is. And then they talked about the CARES, the federal stimulus money that's coming in, and the $1.25 billion. There's some possibility that the county that local government will get some of that financial benefit. I did ask about that.
It'll be funneled down through the state.
It'll be funneling down.
Yeah.
But some of it a lot of it they don't have answers to everything because it's just been
Exactly.
put into place so quickly.
Yeah. And see, KDOT's got some funding. Transportation bill.
Good.
And anything else? Any other meetings we're going to watch?
Yes, this is Commissioner KAAZ. I would also, kind of dovetailing a little bit on Commissioner Stieben, I would encourage people to like or look at the Facebook page for the Workforce Partnership, which is the Workforce Partnership KC, because they are updating available jobs and different resources that are available on a very, very consistent basis on that Facebook page.
Okay. Did everybody get that website?
Well, the Facebook page is Workforce Partnership KC.
Okay. Anything else? Before we adjourn, then I'll entertain a motion to adjourn.
So moved.
Second.
Voting.
Aye.
Aye.
Commissioner KAAZ votes aye.
All right.
Commissioner Schimke votes aye.
All right. Well,